Today I'm going to show you a very exciting procedure for hand veins. It's hand rejuvenation with foam sclerotherapy. Now take a look at this before and after picture. This is taken the same day of the procedure, and these results will get even better over a few weeks. I had my hands done by Dr. Christopher Pittman, an interventional radiologist who specializes in vein care. I love the way my hands turned out. This is just 2 days later. No bruising, no bumps, nothing. Just schoolgirl hands. So let's take a look at my before hands. I had the bulging veins, the ones that are just under the skin. And I had heard of people doing fillers. A lot of women do fillers around them. The same type of dermal fillers that you use on your face, you can use on your hands. But all that does is plump up the skin around the veins so that it's less noticeable. And it has to be repeated every 6 months or so. That's why I was so intrigued with what Dr. Pittman is doing in Tampa. He is actually eliminating these veins with foam sclerotherapy. Now, he is a very qualified interventional radiologist. He works with veins, so I decided to go give it a try. Dr. Christopher Pittman is a medical doctor. He's an interventional radiologist. He is the medical director and CEO of Vein 911. He is very experienced in vein care and very well trained. He's board certified in venous and lymphatic medicine, vascular and interventional radiology, as well as diagnostic radiology. So what are we doing today, Doctor?
Well, nice to see you again, Beckyinboca, and thanks for coming up from the Gold Coast. We really appreciate that. What we're doing today is we're giving you back schoolgirl hands. We talk about schoolgirl legs and giving people schoolgirl legs, which we do all the time, but we can also do that in your hands. So there's many ways to approach hand rejuvenation. I would say the most popular way to approach it is to simply inject fillers around the veins, which obviously doesn't get rid of the vein, and is a good business model because you got to do that every 6 months or so to get rid of those veins, or make them look less apparent, I should say. There are a few places out there which will actually remove the hand veins surgically, which isn't recommended, and I just wouldn't do. There's potential for nerve injury, and it's difficult to impossible to remove all the veins in the back of the hand. So the best approach is liquid or foam sclerotherapy. We use foam sclerotherapy. It's just a bit more effective. So what we simply do is we use a needle the size of a hair shaft, the same needle we would use to get rid of spider veins, which we do all the time, and we inject a foam agent into the veins, and it's basically going to destroy the lining of the vein on contact, and then your body will absorb the vein over a matter of time. I have not found a better analogy, but it's kind of like roadkill. We're going to kill the vein, and then it's going to take a few weeks for the birds and the worms to take the vein away. We're going to inject these veins. Becky's going to feel little to no discomfort. Then we are going to put dental cotton, or little cylinders of firm cotton, over the veins that we treat, because once we injure the lining of the vein, we want the vein to heal shut. So we're going to ask her to wear that for several hours. We're going to ask her to take her rings off, which we already have, because there can be a little bit of finger swelling after treatment for a day or so. So it's best not to treat people with the rings on. The average patient's going to take 2 to 3 sessions of foam, because like most things in medicine, we want to do just enough. We don't want to overdo it. So it's like creating a masterpiece. We want to do several coats of paint. So we're going to do the main coat, or the primer coat, today with some foam. We're going to really focus in on the larger veins, and then in the second or third visits we'll approach the smaller veins, or whatever other veins may be bothering Becky. This is an FDA-approved sclerosant. It's basically a dilute detergent. No, it's not Dove or Palmolive or Dial, but it's similar in chemical way to a dilute detergent. And liquid is effective only in very tiny spider veins, But when we make a foam, we can get rid of veins as big as my thumb or bigger. So foam is just the better way to go. So we're going to create the foam here. And this is how we make the foam. And we will keep doing that during the treatment because we like fresh froth or cappuccino froth or whatever you want to call it. So we're going to keep doing that during the course of the treatment to make sure that the foam is the best quality.
Okay, let's do this. Let's say goodbye to these veiny hands.
And just adds a little bit.
You can see it.
Yep. Oh, you can see it all right. You can see it all right. And we're basically going to paint that vein away. Pinch, pinch, pinch. Backing up just a little bit there.
I don't feel it now.
No. And it just takes a split second and it's going to work. And so what I'm going to do is a little bit more foam here.
Okay, I feel nothing. That's good. Of course, I've done so many needles and things in my face that this is nothing. Okay, I have the little cylinders of cotton taped over the vein. So when you leave the doctor's office, you're going to have these bandages that you have to wear just for a couple of hours to apply pressure. And I have a solution, so you can still go out and do whatever you want to do. Just about all of us have one of these jackets that has the little thumb hooks. You put that on, and you are good to go. This is a few hours after I had the treatment. I took the bandages off. Doesn't hurt at all. There's really no pain. A little bit of achiness. I might take some Tylenol or something. But other than that, this is a few hours later. I am very impressed with the way my hands look so soon after the procedure. I was not expecting that. I thought I would have to wait a few weeks until the remains of the veins dissolved and then the hands would look good, but they look good now. So I'm certainly going to do a follow-up video and show you how they look later. So let's take one more look at the before and the after. Quite a difference, and they should improve over time. 3 days after doing my hands, I am so thrilled. I didn't think they would be this good this fast. It is fabulous. I'm showing off my hands everywhere I go.